Hi, I'm Bettina Jakes, a naturopath, nutritionist, and Hi everyone. I'm Bettina Jakes, a naturopath, nutritionist, and herbalist, and mum of two girls, coming to you from our coffee farm in far north Queensland, surrounded by 85,000 coffee trees. So, Real Talk is about sharing honest, raw truths and my wellness stories in the hope that you can relate and find comfort, but more importantly, that you discover simple steps and clear takeaways of what to do, and when you listen to my story, sometimes of what not to do as well. And this is going to support you ultimately with your hormones, gut, and fertility. So, if you've missed episode 2, go back for a quick watch because now I'm heading back to the doctors. Even though I've tested negative for chlamydia, I'd been having mild lower pelvic pain, but I'd been brushing it off. And now that I've started bleeding from sex, I had to seek some professional help, I realised. So I've found a new doctor this time and made sure to tell him my recent history. I remember feeling much happier that this doctor was more compassionate and understanding, and he listened with concern. It may have been the first time that I realised how important it is in a healing journey to have someone that has a listening ear and shows care. So I left that appointment feeling reassured, much different to my first appointment with the other doctor. So he ordered tests mostly related to my digestive health, a colonoscopy and blood tests to rule out any digestive issues, including celiac disease, that may have been contributing to my pain. And he didn't seem to stress the possibility very much of pelvic inflammatory disease. He did refer me to a gynecologist, and even though I did have all the risk factors, he did seem to think that this was another area we needed to investigate. So I was relieved that my symptoms could possibly be just my digestion, not an infection or a sign of PID. So I must admit, knowing what I know now, it's very possible the antibiotics cleared the infection on my cervix, hence the negative urine test, but residual infection may well have progressed further up into my uterus, and that's where I could well have required another broader spectrum of antibiotics. But that didn't happen for me. So the difficulty with PID is that clinical diagnosis is hard. I didn't want that diagnosis. I feared it greatly. And it's hard to walk towards something that you fear. I really do get that. And so I ran with the possibility that it was instead my digestion, which also made sense to me because even once the bacteria has gone, the inflammatory cascade can persist and create symptoms for a while. Because it's true that my boyfriend didn't get any symptoms returning from him. So it made sense to me that with those 2 rounds of antibiotics, 6 weeks apart, and the stress of the likelihood my boyfriend had cheated on me, putting me at risk of losing my fertility, that it was no wonder that my digestion was compromised. It was never really the strongest to begin with as well. But I guess I'll never truly know what was actually the case for me, except that chlamydia infection, stress, and antibiotics were the catalyst. And it's also true that down the track I did receive a PID diagnosis in a hospital emergency room, but I'm going to share that story with you a bit later in another episode. So I'm happy to say that I've now healed my gut. It's better than it was ever been before, and it's stronger. And we conceived our two girls naturally. So that's going to be, again, another story down the track. And even though this is the case, that my gut is working better now, my overall pelvic health has never been quite the same since. And to finish up, I want to bust a few myths for this episode around PID. So myth 1 is that if your swab is negative for chlamydia, it can't be PID if you're still getting pain. The truth is swabs and urine tests check the lower tract, while PID affects the upper pelvis, the womb, tubes and ovaries. So tests can be negative while inflammation is higher up. And myth 2 is that PID only happens with chlamydia or gonorrhea. And the truth is that this is how it is most common, but it can also be polymicrobial. So that means that bacterial vaginosis or dysbiotic bacteria in the vagina can also be involved, much more rarely. And even more rarely is that a procedure with IUD insertion can cause it as well. So PID is always severe, another myth, and you'll know it if you have it. The truth is that it can be mild or subtle. I wish I knew that. With low-grade pelvic pain or bleeding after sex, even though the sex itself wasn't painful for me. So symptoms should be assessed on a low threshold and treated before it becomes severe. Myth 4 is PID means I'll definitely be infertile. The truth is early treatment protects fertility, and risk does rise with delay, severity, and recurrent episodes. And even if you do tick all the boxes for untreated PID, which may have been the case for me, natural fertility is still possible. Myth 5 is that partners don't need treatment if I'm on antibiotics. And the truth is partners should be tested and retested and treated, and you should avoid sex until treatment is finished and symptoms settle to prevent reinfection. This can be tricky, especially in a new relationship, but stand your ground, ladies, because your health does matter. And myth 6 is that it's just a period pain or digestive comfort. That's what you could be telling yourself. I'll be right. Where the truth is that new pelvic pain, any pain from sex or bleeding, fever or unusual discharge deserves prompt attention. So please go get it checked out. Don't wait for it to get worse. And my take-home tip for this episode is that if you have new pelvic pain or bleeding from sex, again, like I just said, ask directly, go for some professional help, ask directly about PID. And because it is a clinical diagnosis, it requires a professional judgment based on your history, signs, symptoms, and presentations. And sometimes tests can be conducted as well, but not always necessary. So make sure, once again, your partners are checked, and advocate for care that listens and looks at your whole picture. Because once again, early broad spectrum treatment and partner care leads to your best outcomes. So if you enjoyed this episode and listening to my stories, please remember that this was my personal story. Always follow your own guidance and seek professional help. And yeah, please reach out, send an email, a discovery call if this resonated with you, or if you would like some help as well, and some guidance. Don't forget to subscribe and tap the bell, and I look forward to seeing you at the next episode. Thanks everyone. Bye.